I'm Dr. Churan from the Animal Clinic of South Elgin. This is my assistant, Jenny, and this is a Great Dane, Arwin, and she's one of our clinic dogs, so she's frequently here at the clinic. Sometimes she's not. And we want to talk about heartworm. Heartworm is a blood parasite. It is spread by mosquitoes through your dog's bloodstream. When the mosquito bites your dog, the mosquito injects a microscopic heartworm into the dog's bloodstream at that time. Over a period of 5 months, it grows to be a foot long, lodges in your dog's heart, where it can kill your dog. So very easy to prevent this, however, with a once-a-month medication. Now, your dog does need to be tested annually, and the reason for that is it is very safe to kill the tiny microscopic heartworms that the mosquitoes are putting into your dog. However, if your dog has an adult heartworm, which could happen if you weren't giving heartworm medication at all, or if you were giving it but you missed a dose because you thought somebody else gave it and they thought you gave it, or sometimes people really did give it but the dog went outside and maybe vomited it. So that left a window of opportunity where a missed dose where your dog could be infected. Because of that, it's really important for your dog to be tested for heartworms every year, even if you have been giving the medication faithfully. And the reason for that is if we kill an adult heartworm in the dog's heart, that adult heartworm, which is large, can clog the great vessels of the heart and your dog would drop dead. So that is a sudden death, which is completely unexplained and something that we never want to happen. Now, a heartworm blood test that we do here at the Animal Clinic of South Elgin also tests for Lyme disease and other tick diseases, which are other emerging parasite problems and problems with disease that we have with dogs. And those are treatable diseases if we catch them early, before permanent damage is done. Heartworm preventative, we have a variety of brands which do many different things. The most basic heartworm preventative is a once-a-month pill that you give your dog, and that controls heartworms and 2 kinds of intestinal parasites. We also have upgrade pills which take care of heartworms and 3 kinds of intestinal parasites. We have a heartworm pill Sentinel, which has an additional ingredient which prevents fleas, as well as taking care of the heartworms and 3 kinds of intestinal parasites. That's our most popular preventative in this practice, because if anybody who's ever had fleas have found it is certainly much more easy to protect against flea infestation and prevent it rather than wait till you have fleas and then have to deal with your house being infested and everything that entails to detail that. And obviously giving your dog a pill once a month, pretty darn easy compared to how much work it is to get rid of a flea infestation in your house. We also have a topical heartworm preventative, and the reason that most people would choose that is that it does not involve anything oral. Every once in a while people have a dog that is very frustrating to give oral medication to, that the dog is not cooperative with that at all. So a topical medicine that you just squirt on the back of their neck obviously is very easy for anyone to do, even if their cat won't, or if their dog won't tolerate a pill. Cats can be infected with heartworms also, much less common than dogs, but when cats do get heartworms, it can be much more severe. Because a cat is so small and their heart is very small, 1 heartworm can kill a cat. And they get a lot of lung pathology rather than heart pathology, so they get asthma-type symptoms. Heartworm is also very preventable in cats. And again, your choice is an oral medication once a month or a topical once a month. So both of those things are very easy to do, and preventative medicine, just like in people, is always better than waiting till we have a problem. Heartworm can be treated, so if your dog is positive for heartworms, it can be treated. However, that treatment is not only expensive, but it is very hard on the dog, and it's going to make them very sick to undergo that treatment for probably a 6-week period. So preventing that and preventing the permanent damage that may never be undone by having been infected with heartworm is a much better goal. We do recommend heartworm preventative 12 months of the year, and part of that is because our seasons are not very predictable, So sometimes we think, oh, we're done with mosquito season, then we'll get a warm period and mosquitoes come back, and people might have, chosen to quit giving it by that point in time. The other thing is controlling the intestinal parasites is very important, and that's important for your family's health as well as for your dog's health. And there is no season to intestinal parasite infection. So we want to make very certain that we protect the family as well as the dog. So heartworm preventative once a month is an easy choice to do and a good choice for your pet's health.